I'm an orthopedic joint surgeon. And throughout my career, I've operated on more than 12,000 seniors. What I'm about to tell you may surprise you. The world's most commonly recommended healthy exercise is quietly damaging millions of knees, hips, and spines after the age of 60. For decades, we were told that walking is the best form of exercise, capable of protecting your heart, strengthening your legs, and keeping you mobile for life. But inside operating rooms around the world, we're seeing a very different reality. Seniors who walk daily, even those reaching 10,000 steps, are arriving with fractured knees, inflamed joints, and cartilage worn down so severely that their bones grind together like sandpaper. You've been sold a myth, and it's a profitable one. The global walking, fitness, and wearable tracking industry is valued at more than $300 billion. Big shoe brands, fitness tracker companies, and pharmaceutical giants earn more money every time you believe walking alone will protect your joints as you age. The truth is this: only 5 forms of movement are proven by orthopedic and vascular science to rebuild strength, protect joints, and preserve mobility for decades longer. From thousands of exercise variations out there, spanning strength, balance, endurance, and flexibility, only 5 surgeon-approved movements consistently show clinical results. These exercises can reverse muscle loss, improve blood circulation, strengthen your stabilizing muscles, and reduce fracture risk by more than 40%. In today's video, we're revealing the 5 surgeon-approved exercises that outperform walking, rebuild joint integrity, and fight age-related muscle loss faster than any medication, treadmill routine, or supplement ever could. And you'll want to stick around, because number 2 is the most surprising of all. A movement so simple that hospitals in Japan now use it to restore lower body strength in post-surgery seniors up to 40% faster than traditional physical therapy alone. All clinical studies and hospital data are cited in the description below. Sourced directly from Harvard Health, Mayo Clinic, and international orthopedic journals. Before we begin, a quick question: where are you watching from? And how many minutes a day do you currently walk or exercise? Drop your answer in the comments. Our team is reading every single one tonight. Seriously, everyone. And now, without any further delay, let's begin with exercise number 5. The first exercise orthopedic surgeons recommend as safer than walking, and one that strengthens twice as many muscles while protecting your knees for life, is the wall push-up with progressive resistance. Many people assume push-ups are only for young athletes or military training. Yet the wall push-up may be one of the most underestimated exercises for seniors today. Researchers at the American College of Sports Medicine studied adults over 60 and found that those performing modified push-ups 3 times per week increased their functional strength by 34% in just 8 weeks. In comparison, the walking-only group improved by just 7%. Wall push-ups are so effective because they activate several major muscle groups at once, including the chest, shoulders, triceps, and most importantly, the core stabilizers that help prevent dangerous falls. Upper body strength plays a crucial role in daily life. It determines whether you can catch yourself if you trip, push yourself up from a chair, and carry groceries without strain. Wall push-ups build this strength by creating gentle resistance against gravity while keeping your body in a safe, upright position that virtually eliminates injury risk. Proper starting position is essential. Stand about 1 arm's length from a wall and place your palms flat at shoulder height and shoulder width apart. Lean forward until your nose nearly touches the wall. Then push back to the starting position. Maintain a straight line from your head to your heels, keeping your core engaged throughout the movement. As you get stronger, increase the challenge by stepping slightly farther away from the wall, increasing the angle and therefore the resistance. According to the Cleveland Clinic, maintaining upper body strength after the age of 60 reduces the risk of rotator cuff injuries by 41%. This matters because rotator cuff damage often triggers a chain reaction of mobility issues. Real-world results are equally impressive. Margaret, a 68-year-old retired teacher, struggled to open simple pickle jars until she began practicing wall push-ups daily, within a month. She regained her grip strength with ease. This exercise also helps improve bone density in the arms and shoulders, areas vulnerable to osteoporosis, with studies showing up to a 2.8% increase in bone mineral density after 6 months of consistent practice. It's important to understand that walking primarily works the lower body, leaving the upper body to weaken gradually with age. This weakness is the reason many seniors struggle with everyday tasks like reaching overhead cabinets or pushing open heavy doors. Transitioning from walking alone to targeted resistance training may feel intimidating, but the exercises in this video are designed to build on each other in a simple, progressive way. If you've been enjoying what you've learned so far, remember to like this video, subscribe to the channel, and tap the bell icon so you never miss future senior-friendly fitness tips. Number 4. Chair squats with controlled tempo. The chair squat may be the single most functional exercise you can perform after age 60, because it directly translates to a movement you perform dozens of times a day without even thinking about it. A comprehensive study published in the Journal of Aging and Physical Activity found that seniors who practice chair squats regularly improved their sit-to-stand time by 43% and reduced their risk of mobility-related disability by 38% over a 2-year period. This exercise isn't just about building leg strength, although that's certainly important. Chair squats engage your entire posterior chain, including the glutes, hamstrings, and lower back muscles, while also improving balance and proprioception, which is your body's ability to sense its position in space. The quadriceps muscles on the front of your thighs decline faster than almost any other muscle group as you age, losing up to 40% of their mass between the ages of 50 and 80 if left untrained. That dramatic loss is why many seniors struggle to rise from low chairs or toilets without using their arms for assistance. Chair squats target these exact muscles while providing the safety of a support surface, making the exercise accessible to nearly everyone. To perform them correctly, sit near the edge of a sturdy chair with your feet hip-width apart and your toes slightly outward. Cross your arms over your chest to avoid using momentum, and stand by pushing through your heels while keeping your chest lifted and spine neutral. The real magic happens on the way back down. Lower yourself slowly for 3 to 4 seconds before lightly touching the chair. This controlled lowering, known as eccentric training, maximizes muscle activation and stimulates strength gains faster than quick or bouncy movements. Research from the National Institute on Aging shows that eccentric training increases muscle mass up to 10% more effectively than standard speed exercises while producing less cardiovascular stress, an ideal combination for seniors with heart concerns. Real-world benefits are just as powerful. Robert, a 71-year-old grandfather, went from needing help to rise from his recliner to playing on the floor with his grandchildren after 3 months of daily chair squats. These muscles are the same ones you use to stand up, sit down, climb stairs, or get in and out of a car. Your independence depends on their ability to lift and lower your body weight repeatedly throughout the day. Beyond physical strength, research shows that improved lower body muscle function correlates with better cognitive performance. The increased blood flow during these exercises may enhance neuroplasticity, the brain's ability to form new connections. Unfortunately, the fear of falling often causes seniors to move less, creating a downward spiral of weakness, instability, and even more fear. That's why the next exercise directly addresses this issue. Number 3. Single leg stands with progressive challenges. Balance may seem like something you either have or you don't, but the reality is that it's a skill that can be trained and dramatically improved at any age. Research from the Mayo Clinic revealed that the ability to balance on one leg for just 10 seconds after age 70 is associated with a 50% reduction in all-cause mortality over the next 7 years. That's not a typo. Your balance can literally predict how long and how well you will live. The single leg stand works by challenging three critical systems at the same time: the vestibular system in your inner ear, the visual system that helps your brain map the environment, and the proprioceptive system within your muscles and joints. When you practice this exercise regularly, you're essentially recalibrating these systems to work together more efficiently, improving balance in nearly every daily activity. It also strengthens the small stabilizing muscles around the ankles, muscles that weaken rapidly with age and disuse. Targeting them reduces the risk of ankle rolls, sprains, and falls. Even adults over 80 respond remarkably well to progressive balance training. Begin by standing near a sturdy surface like a kitchen counter. Lift 1 foot an inch off the ground and hold for 10 seconds. As this becomes easy, challenge yourself by closing your eyes, moving your head side to side, or standing on a softer surface such as a pillow. Each progression forces your nervous system to adapt, improving coordination and stability. A study in the British Medical Journal found that seniors who practiced single-leg stands for just 5 minutes daily reduced their fall risk by 36% and improved their walking speed by 12%. Walking speed is especially important in geriatric medicine. Gait speed is now considered the 6th vital sign because it predicts cognitive decline, cardiovascular events, and overall survival. Dorothy, a 74-year-old who stopped social outings after a minor fall, regained her confidence through 6 weeks of balance training and now leads local hiking groups. The neurological benefits extend even further. Brain imaging studies show increased gray matter in regions responsible for spatial awareness and coordination after balance-based exercises. In other words, your brain continues building new neural connections well into later life. The fear of falling causes many seniors to avoid challenges. But avoiding movement accelerates decline. That's why the next exercise is crucial for preserving coordination, confidence, and mobility. Number 2, resistance band rows for posture and back strength. That forward hunched posture seen in so many older adults isn't just a cosmetic concern. It's a medical condition called kyphosis, and it can affect breathing, digestion, balance, and overall mobility. Studies show it increases fall risk by up to 45%. A landmark study from UCLA found that seniors with excessive forward posture were 3.47 times more likely to require assistance with daily activities and had 44% higher mortality rates than those with normal spinal alignment. Resistance band rows directly combat this problem by strengthening the rhomboids, middle trapezius, and rear deltoids, the exact muscles responsible for pulling the shoulders back and maintaining an upright posture. Unlike walking, which does virtually nothing for these postural muscles, resistance band training introduces a specific pulling motion that counteracts years of forward dominant activities like driving, cooking, reading, and computer use. These daily habits gradually pull you forward. And without targeted exercise, gravity wins. One major advantage of resistance bands is variable resistance, meaning the exercise becomes harder the farther you pull. This perfectly matches your muscle strength curve and reduces strain on your joints. Research shows resistance bands can produce strength gains 27% faster than traditional weights in older adults, while being significantly safer for connective tissues. To perform the exercise, secure a resistance band at chest height. Step back until you feel tension. Then pull the handles toward your ribs while squeezing your shoulder blades together. Imagine trying to crack a walnut between your shoulder blades. This cues the correct muscle activation instead of overusing your arm muscles. Studies published in the Archives of Physical Medicine and Rehabilitation found that seniors who performed resistance band exercises 3 times per week improved their posture measurements by an average of 3.2 centimeters and reduced chronic back pain by 58%. Better posture doesn't just reduce fall risk, it improves lung expansion by giving the rib cage more room, with research showing a 23% increase in vital lung capacity. This improvement can be life-changing. George, a 69-year-old accountant, Went from struggling to stand straight to receiving compliments on his youthful posture after just 2 months of resistance band training. Grip strength also increases with this exercise. And while it may seem unrelated, grip strength is one of the strongest predictors of overall health and longevity in older adults. Stronger postural muscles influence nearly every movement you make, reaching for groceries, carrying bags or laundry, standing from a chair, walking on uneven ground, maintaining confidence during social activities. The cascade effect of better posture improves energy levels, mood, breathing efficiency, balance, gait stability, and even perceived age. And now, with posture restored and balance improved, the number one exercise combines both strength and coordination for maximum longevity benefits. The number one exercise on this list takes all of these benefits to an entirely different level. Tai Chi movement patterns are uniquely powerful for neural rewiring, balance, and whole body coordination. When Harvard Medical School researchers followed more than 1,200 seniors over 5 years, they discovered that those who practiced Tai Chi for just 20 minutes, 3 times per week, reduced their fall risk by an astounding 47%. It outperformed every other intervention, including strength training, traditional balance exercises, and walking combined. But that is only the beginning of what makes Tai Chi the ultimate exercise for people over 60. This ancient practice does far more than strengthen muscles or improve stability. It literally rewires the brain's motor pathways, creating new neural circuits that make movement more efficient, accurate, and automatic. Brain scans of regular Tai Chi practitioners show increased gray matter volume in the motor cortex, hippocampus, and prefrontal cortex, the areas responsible for movement, memory, and executive function. The slow-flowing motions require constant weight shifting, rotation, and coordination between the upper and lower body, challenging the nervous system in ways most traditional exercises cannot replicate. Unlike the repetitive nature of walking, every Tai Chi transition is slightly different, forcing the brain to stay engaged and adaptive. Studies show that this constant variation stimulates neuroplasticity, the brain's ability to form new connections even late in life. The meditative component reduces cortisol levels by up to 31%, which is crucial because chronic stress accelerates muscle loss, suppresses immunity, and speeds cognitive decline. As we age, the body's stress response becomes chronically activated, breaking down tissue instead of repairing it. Tai Chi interrupts this harmful cycle through gentle movement and focused breathing, activating the parasympathetic nervous system and promoting healing rather than breakdown. A groundbreaking study from Emory University showed that Tai Chi practitioners over 70 had reaction times comparable to individuals 20 years younger and maintained their walking speed 32% better than non-practitioners over a 10-year period. It improves proprioception so effectively that practitioners can often balance with their eyes closed, almost as well as most people can with their eyes open. Research published in the New England Journal of Medicine found that Tai Chi was more effective than physical therapy for reducing pain and improving function in seniors with knee osteoarthritis, with benefits lasting months after practice ended. Because the movements are weight-bearing, bone density can increase by 2.6 to 6% annually compared to the typical 1% yearly loss in sedentary adults. Barbara, a 77-year-old who began Tai Chi after experiencing 2 falls, has not fallen once in 3 years and says she feels more graceful than she did at 50. The practice requires no equipment, can be modified for any fitness level, and becomes increasingly beneficial the longer you stay consistent, with studies showing continued improvement even after 5 years of regular practice. The brain craves novel movement patterns with age, and Tai Chi provides infinite variation within a safe, structured framework. The social aspect of group Tai Chi training adds yet another layer of benefit, with participants showing lower rates of depression, anxiety, and cognitive decline compared to those who exercise alone. The revolution in senior fitness is not about working harder or walking more miles. It is about working smarter with exercises that target the specific vulnerabilities of aging bodies while promoting neurological health and functional independence. Together, the 5 exercises in this program create a comprehensive system that addresses every major area affected by aging: muscular strength, balance, posture, coordination, and neural function. The research is overwhelming. Seniors who incorporate resistance training, balance work, and mind-body practices into their routines do not just live longer, they maintain their independence, reduce healthcare costs, and enjoy a quality of life that seemed impossible just a generation ago. The old model of aging, where decline was considered inevitable and walking alone was thought to be enough, is outdated. We now know that targeted exercise can reverse many aspects of physical decline, rebuild lost muscle, strengthen bones, and rewire the brain for better movement and cognition. Today, the choice is not between exercising and not exercising. It is between doing exercises that merely slow decline versus exercises that actively reverse it and build resilience. Every day you delay allows muscles to waste, balance to deteriorate, and fall risk to increase. But every day you practice these movements, you are actively rebuilding strength, restoring stability, and protecting your future self. The path forward is clear. The science is conclusive, and the tools are simple and accessible. Your future, stronger and more confident body will thank you for starting today. If you have any questions or would like to share your experiences, feel free to leave a comment below. We are always listening. Thanks for watching.